My name is Jetal Solanki. I am doing fellowship in Pediatric Optometry with Indian Academy of Optometry. Today I'll discuss about vision therapy. So first question is whom to advise vision therapy. Sometimes the patient comes with a convergence insufficiency, amblyopia, poor eye-hand coordination, difficulty in binocularity, difficulty in fixation. So in that case we can advise vision therapy. So first we'll discuss about convergence insufficiency. So first of all, what is convergence? Convergence is ability of our eyes to converge. Like if I'm seeing something in near, so my both eyes will converge and fix it at the same point. But some patients have difficulty in this convergence. So how will check the convergence? For that, take any pointed object and at the hand level distance, focus on a point, and the point should be single and clear throughout the checkup. So if sometimes patient is saying double vision, so that distance is measured between eye and this pen. If the distance is more than 8 cm, then patient have a poor convergence. So in that case, this same exercise is given. This is pencil push-up exercise. So in which when point is double, ask patient to focus on a point and make it single, and gradually decrease the distance between eye and pen. So this exercise is used to converge, help patient to converge, and when conversion is improved, the patient symptoms, headache, eye strain will decrease gradually. Now second is amblyopia. Amblyopia is a condition where eye and brain development is not proper, and so with glasses also vision is not 6/6. So in that case, first treatment is full correction glasses, and with the glasses give patching. Patching is a patch good eye, like if patient have a 6/6 vision in one eye with the glasses, but the other eye has 6/9 or less than 6/6 vision. So good eye with a 6/6 vision eye, just patch that eye with the glasses and use the other eye for the near work. And duration of the patch depends on the age and refraction and how much vision is less. And then give a follow-up. In follow-up you can see how much vision is improved, and then gradually you can decrease the patching. So patching is very effective, but other things are also there, like some software-based therapy and synoptophore, that both are used for vision therapy. Synoptophore is a machine in which two slides are there, and that slides have a prism and lens. They placed in such a way that image will create at a distance, far distance level. So the muscles, eye muscles are relaxed. So in synoptophore we can also measure angle of deviation, and we can also give treatment for convergence insufficiency by doing a fusion. So for measuring angle of deviation, we require simultaneous macular perception slides. We put both slides in a machine and ask patient to see, like one slide has a lion and one has a cage. So that lion should be on a cage, and ask patient to move the lever. So when lion is inside the cage, and see the readings in the machine. If both readings are 0, then patient won't have any deviation. In case of deviation, it will give a amount of deviation. Now at that point, remove the SNP slides and put a fusion slide. And fusion is like a pencil push-up, pencil exercise, but in pencil, when one eye is suppressing, we don't know, patient will see the single image only, we will not see double, but he is not using the both eyes. So in fusion we can see whether patient is using both eyes or not. So in fusion slide, two objects are there, but they are incomplete. So if patient is seeing a one object with complete details, means he is using his both eyes. And fusion range is there. So if fusion is coming in a normal range, then patient won't have any fusion problem. So you can read readings of fusion, SMP and all before starting the therapy, and after therapy you can compare like what was the reading initially and what it is now after therapy, and accordingly you can see whether patient need to do home exercise only, continue the clinical exercise also. And in software based exercise, it is same like in synoptophore, both eyes are using at a time separately. So that is done in a software exercise with the glasses, like red and green glasses or red and blue glasses are used during the therapy, so that both eyes will use separately. And in program we have we can do eye movement, fixation, convergence, divergence, like that. And in vision therapy, Brock string also used, like in pen, one eye is suppressed, so patient will not see. So patient will not see double object. But in Brock string, two strings are seen, means patient is using both the eyes. So Brock string also used in vision therapy. Sometimes plus or minus flipper are also used in vision therapy. And mainly pencil push-up, patching, synoptophore and software based exercise are used in a vision therapy. Thank you.